I'm going to start my lecture, and I want you guys to be involved in it. I don't want to be the teacher teaching you guys. I want you guys to ask questions and let me know if you guys don't understand anything, and I will be asking questions along the way too. Okay? So let's start. So what are camelids? Camelids they belong to a family of even-toed ungulates. Ungulates are mammals that have hooves. So all ruminants and camels are going to be in this broad classification of mammals. And they are even-toed. They will be separate from the ruminants because they have a soft pad toe as compared to the ruminants that have a hard padded hoof. Okay, so camelids are something that is growing currently in the US. There are very few vets present in the US and Canada that actually specialize in them. They are used for fiber production and sometimes companion animals. Questions related to camelids belong to the exotic pets in NAVLE and BCSE. So you get around 5% questions from the exotics in NAVLE and 5% in BCSE as well. So it will be around 30 to 60 questions in NAVLE and 10 to 20 questions in BCSE. Okay, what is the distinctive behavior that they show? So have you guys seen the movie Ice Age Collision Course, which is an animated movie?
Yes.
Yes. So in that movie, we see a llama that does yoga, right? And you see that llama spitting and a few of his colleagues trying to catch the spit. So that is a distinctive feature which is present in case of camelids. They have a spitting behavior, and it is an act of dominance. Sometimes it is used as a defense. And how do they do this? So the mechanism involves eructation. Eructation means burping. So they will burp partially fermented C1 contents that have a pH of 6.2. When we study about the stomach, that is going to be in the coming slides, I'm going to show you where C1 is and how it looks like. But you need to remember it's partially fermented. They can go up to 3 meters or 10 feet range projectile. And they prep before they spit. So they are going to turn their ears backward. They are going to do an extension of the neck, and they will have a classical guttural vocalization before they spit. The spit test is also used to determine pregnancy. So a pregnant female is going to spit at an intact male. Next comes vocalization. They have a classic vocalization, which is known as orgling. It is a low frequency guttural mating call. All the camelids are induced ovulators. So they are going to ovulate when there is ovulating inducing factor in the semen that will stimulate the ovulation. Can you guys name another species of animal that are induced ovulators?
Cat and rabbit.
Yes, is good. Then the other sounds include humming, for mother and cry bonding, a high-pitched screech, which is an alarm call, and clucking, which is submissive interaction. So in your exams, you are not going to get uh, questions related to vocalization, but you need to remember the terms like humming or orgling. You can get questions related to that and where are they used. Then comes the posture. So they have a sternal posture as shown in the picture, which is known as Cushing. It's a resting posture. So they're going to sit in this position with all of their legs folded. And they will not be able to have a good Cushing posture when they have joint related issues because they're folding all of their feet and when they have abdominal pain or colic. Okay. So camelids are known as pseudo-ruminants because they have a three-chambered stomach as compared to the true ruminants that have a four-chambered stomach. So we talked about the C1. This is the C1 that has around 85% volume, which performs all the fermentation. And because of the increased fermentation, there are high risks of bloat in the C1. The second compartment is the C2, which has only 6% volume and it does fluid absorption. Now, the C2 is close to the heart and the diaphragm. So this is the site where you're going to see hardware disease. Camelids, like other ruminants, are also indiscreet eaters. They eat anything with their food. So hardware disease is one of the disease that you can encounter with them. C2 is similar to the reticulum in case of ruminants. Then there is C3, which is around 9% in volume, and this is called as a true stomach. The acid digestion takes place in C3. And because of the increased acidity in this area, you will see ulcerations in case of stress. In small animals, so when they are young, they have a ventricular groove that shunts milk directly into the C3, which is the true stomach, and it closes by 2 or 3 months of age. They have a very distinctive potty way, I would say. So what they do is they are like cats. They use litter boxes. So they use 3 or 5 designated sites that they are going to poop at. And this helps us because it's going to control parasite and not allow transmission of any other parasitic infections. Their dung is like a superior fertilizer because it contains high contents of nitrogen. Any questions so far?
Sometimes
Okay.
we sometimes we studies in books that the part of omesum, those are not present in pseudoruminants, should be present in very rudimentary form. Uh, is correct or it should be always not present?
I didn't get you. I couldn't hear the first sentence.
A- Actually, we see in the books that they are telling us that the C4 part, those are also known as omesum of the
Mm-hmm.
ruminants, is
Mm-hmm.
absent in pseudoruminants like
Yes.
camelidae, and
Mm-hmm.
somewhere in the books is also mentioned that these parts are present in rudimentary form, not absent. So is it right or wrong? Is totally
Okay.
absent or in a room?
I will have to check on that because my anatomy related to camelids is something I need to focus more on. So I will check and I will get back to you on that, whether they are present in some other form or they're absent. But as far as the test goes, they are absent.
Yeah, yeah. Thank you.
Okay. Okay, let's move ahead. Okay, now the camelid erythrocytes have a different shape as compared to the normal ruminants or mammalian erythrocytes. They have an elliptical form or a fusiform shape, and they do not have a central pallor like other mammals, and they have a high membrane flexibility. Plus, because they don't have a central pallor, they have more content of hemoglobin, and they can be used as high altitude companion animals because they can transport oxygen better. Okay, so this form, that is the elliptical or the fusiform form of the RBCs, is going to reduce the PCV as compared to that of the ruminants. It is because of the shape. So just imagine rice grains, stacking up rice grains in a small tube. They're going to stack up way better as compared to maybe Cheerios that are circular. So because they stack well, you will have a PCV that is lower than ruminants. The RBC count is high because of the small size. And as they have a different shape, we cannot use automatic analyzers in order to check the number of RBCs. We will have to do a manual differential count. Okay, now we go to the disorders. This is a very important question related to BCSE and NAVLE, which is Berserk male syndrome, BMS. It is a behavioral disorder that cries develop when they are adults. So the cries that are raised by humans imprint themselves on that human and lead to an aggressive behavior towards anyone that comes to that human. So they show behaviors like charging, chest butting, and sometimes biting. So in order to manage this, we should perform early herd introduction. And if they have it, we can go ahead with castration to reduce the aggression and do behavioral modifications. So the question in BCSE is going to be related to the behavioral disorder. They can ask you a question like, if a cry imprints on a human, what kind of disease is he going to develop in adulthood? In NAVLE, you will get a situation that a cry has been raised by a human and is showing aggressive behavior. So what do you think it is? Next. Then we have the meningeal worm. So the life cycle in this worm is pretty important, for which I want you guys to pay good attention. And I will be asking a question after that, okay? So this life cycle has an intermediate host, which is a land snail or a slug, a definitive host that is the white-tailed deer, and an aberrant or a dead-end host, which is the camelid. So the intermediate host is going to harbor the L1 larvae and convert it into L3 larvae. This intermediate host, when ingested by the definitive host, there will be transfer of L3 larvae into the GI tract of the white-tailed deer. From the GI tract, it is going to enter into the spinal cord via the blood circulation. And in the spinal cord of the white-tailed deer, it's going to mature into an adult worm. This adult worm will lay eggs, the eggs will hatch, and the L1 will be coughed up into the mouth through the lungs and enter into the GI tract and be present in the feces of the white-tailed deer. When the feces of the white-tailed deer, including the L1 larvae, is ingested by the slugs and land snails, there will be conversion of L1 to L3 again, and this life cycle goes on. Okay, so when these intermediate hosts enter into a pasture with camelids, they will lead to transfer of L3 larvae into the camelids. Similar to the white-tailed deer, the larvae is going to enter into the gut. From the blood circulation, it will reach the spinal cord and it will stay there. But in the camelids, it does a bad migration. Easy way to say it, a bad migration. So it's going to migrate in a very heavy manner, leading to a lot of inflammation in the spinal cord. Because they are a dead-end host, there will be no maturation of L3 to adult worms. There will be no production of eggs. So my next question to you guys is going to be, how are you going to detect if the camelid has a meningeal worm? Did everybody understand the life cycle?
I'm not good, but I think we should go with the body signs. Those are shown by the patient.
Any
Or
tests that you would do in order to determine what is present?
if
Like how do you determine a parasitic infection in others? What tests
or
do you do?
if it is infected by parasitic infection, then we should culture blood slide in microscope. We should see them.
Okay, what about
Hunting
GI
tests,
Yeah,
flotation
So
tests.
we do a
GI test,
flotation. Yeah, we do a fecal test, correct? For
fecal test is
all
good.
worms, we perform a fecal test. But in this situation, there is no maturation of L3 to adult worms, and there is no laying of eggs. So you will not find anything in the fecal test. So the only way to determine that the camelid is showing signs because of migration of L3 larvae in the spinal cord is by eliminating the others.
What is the
Because
meaning of eliminating the others?
eliminating other diseases. So if
Okay.
there is a spinal cord lesion, we will do a neurologic exam to eliminate that. We can do an X-ray to see if there's any anatomical changes in the spinal cord causing this situation. So you have to eliminate others and then do a treatment and see if that treatment works. The other way will include a necropsy if one of the animal dies. So you will find L3 present in the spinal cord, which determines that there can be a meningeal worm infection in the herd. And the easiest way to stop this is controlling the intermediate host. Because if there is no intermediate host, there's no conversion of L1 to L3. Also, if there is a white-tailed deer in your pasture that is pooping in your pasture, will not lead to transfer into the aberrant host because the intermediate host is required to mature the L1 to L3 that causes the signs in the camelids. Correct? So the easiest way is to eliminate the intermediate host. Any questions?
Yeah, I have a question on the previous slide in which you say that the male syndrome is there. In India, we see that camels are behavior changes in their heated period from November to March.
Mm-hmm.
And sometimes we think that it should be because of coming of winters.
Mm-hmm.
If I am, matlab, I don't know anything, but I want to know that in America, the llama is also doing same thing, or it should be in always in heat period.
I haven't encountered a llama doing things like that, so
Okay.
I'm not sure about that.
Okay.
Okay, anything related to meningeal worm that you guys have a doubt on? Okay, so because the migration is in the spinal cord, what signs are we going to see? We are going to see ataxia, scoliosis, or hind limb paralysis. This L3 can also migrate into the brain and cause cerebral signs, but these signs are rare, but you cannot eliminate them. The other disease in llama that can cause cerebral spine is the disease famous in India, which is rabies. Okay, so for prevention, what you can do is you can do deworming with ivermectin that kills the L3 larvae if ingested. And you can do pasture rotation. Treatment includes fenbendazole because it crosses the blood-brain barrier and anti-inflammatory medicines to reduce the inflammation in the spinal cord. Next comes ectoparasites. So, like horses, mites, that is, choreoptic mites, are present in camelids too. And similar to horses, where you will see this mites in below the fetlock region, you will see these mites in camelids between the toes. They will lead to hyperkeratosis, pleuritis, alopecia, scaling, everything that mites do. Then comes lice. So lice are of two types, biting and sucking lice. They are going to cause ruct, coat, and pleuritis. And if it's a sucking lice, it will cause anemia and scaling. So the treatment for sucking lice is ivermectin, and for biting lice is topical pyrethrines. Now, the camelid fiber lacks lanolin. Lanolin is something that helps with effective spread of topical medicines. It is something that most of the beauty products include. It helps in spreading the beauty product in a good way. So because they lack lanolin, the spread of your topical pyrethrin is not going to be even, and they will, because the spread is not even, it's going to be less effective and the absorption reduces. So that is one of the issues with topical pyrethroids and camelids. They also show tics, and tics leads to flaccid paralysis. Horner syndrome, if it is in the ear, head tilting, are the famous signs that can be seen because of tics in camelids. Then comes mycoplasmosis. Like in cats, mycoplasma will cause anemia in camelids. Please ignore this picture. I couldn't find a good picture without the central paler. So I have uploaded one with the central paler. But in camelids, we all know there will be no central paler and the shape is going to be similar. So it's going to be a fusiform shape. So you're going to see pale mucous membranes. There will be weight loss, lethargy. We will see anemia on CBC and visible organisms in peripheral blood smears. We can do confirmation with a PCR test, and treatment, like in cats, include long-acting tetracyclines. Then comes coccidiosis. Coccidiosis will lead to weight loss, lethargy. They can also cause colic. Diarrhea is less common in adults, but it is common in case of young ones. We can see a few neurologic signs and sudden death related to coccidiosis. Diagnosis includes a fecal exam. Because the oocyte is heavy and large, we need to do an extended flotation time to determine it. One of the important features is hypoproteinemia that will be present with coccidiosis, and treatment includes oral conazuril or parenteral sulfadimethozine. We talked about gastrointestinal ulcerations present in the C3 compartment, which is the true stomach. The triggers include stress related to either environmental changes, isolation, or illness. Location is the distal fifth of C3 and proximal duodenum. Signs will include decreased appetite, colic, frequent Cushing because of pain. We will see teeth grinding, melena, and sometimes hypersalivation. Treatment for GI ulcers include omeprazole. Can somebody tell me the mechanism of omeprazole, how it works, and why are we using it for GI ulceration?
Proton pump blocker, so that's why it's used for acidity.
Yes, it is a proton pump inhibitor, and it is going to reduce the production of acids, therefore giving time for the mucosa to heal, mucus layer to heal. Okay, then comes hepatic lipidosis. This is also because of stress or poor nutrition. We will see anorexia, there will be weight loss, all hepatic signs like icterus. We can see hepatic encephalopathy, which will show signs like head pressing and sometimes blindness. Diagnosis will include liver tests, that is on serum biochem. Definitive diagnosis will require a biopsy. The elevated NEFA and VHB is something that elevates because of negative energy balance in the body. And this is not so important related to the exams, but you need to remember that bile acids, GGTs are going to increase, and the definitive diagnosis will include a liver biopsy. Prognosis is guarded because the recovery takes weeks and months. Treatment will include supportive care with IV fluids, glucose to prevent the negative energy balance, analgesics, and companionship to reduce the stress. Nutritional support will have high carbohydrates, low-fat diet, and we can do tube feeding in severe cases. Then comes the congenital or inherited defects. Now, these are very important with BCSE exam. So they have atresia ani, which is failure of the dorsal membrane between the rectum and the anus to rupture. So there will be tenesmus, that is straining to poop. And because the membrane has not ruptured, they cannot poop. So there will be abdominal distension. Surgical correction is not successful. So humane euthanasia is what is recommended. Then comes cloanal atresia, which is failure of the cloaca to open during embryonic development. So you will see respiratory distress, especially during nursing, and it can lead to aspiration pneumonia. Here, euthanasia is most human option, especially in severe cases, and it can co-occur with wry face. Wry face is lateral deviation of the maxilla. It will lead to issues with chewing and can lead to dental malocclusions. We will see tear staining due to the nasolacrimal duct obstruction, and it requires management. Okay. Other major infections include foot and mouth disease. So the signs of foot and mouth disease are less severe as compared to that of ruminants, and they show seroconversions. Then we'll talk about rabies. So rabies, like other animals, will show signs like hypersalivation, aggression, and photophobia. And vaccination, we can do it with sheep rabies vaccines. Then comes bovine viral diarrhea. So bovine viral diarrhea, persistent infection in these animals is rare, but the mucosal disease has been reported. We will use PCR in order to determine or diagnose it over skin biopsies.
So what is the mean of vaccination is off-label?
Vaccination off-label means only in places where rabies is evident, they can do, and off-label use means it is not said that this is going to protect them from rabies, but it is something we are using just to prevent rabies. So there's no vaccine made for camelids for rabies. So we use the sheep vaccines instead, and they have shown good protection. Okay. Then practitioners' reference will include blood work. So as we discussed, manual differentiation is required. Parasitology, a flotation needs to be extended for the coccidia. Neurology, meningeal worms are going to cause ascending ataxia and rarely cerebral signs. Pain management, we can use flunixin doses at 1.1 mg per kg IV. And meloxicam is also preferred in case of chronic cases. Parasite control, ivermectin for prevention. Vaccinations include CDT as a core vaccine. Can one of you guys tell me what CDT means? CDT is Clostridium type C, Clostridium type D, and Clostridium tetanus. Type C will cause hemorrhagic enteritis, D will cause pulpy kidney disease, and T is tetanus, which is the core vaccine. We are going to use 8-8-8 week protocol. So it will be 1 vaccine and 2 boosters. Rabies only to be used in endemic areas. For nutrition, we need to provide them with copper and zinc. And behavior, isolate human red males and prioritize herd integration early. Okay. Now, so on the basis of clinical science, you can narrow down your diagnosis, and let's talk about that. So if you have a neonate with respiratory distress, there are higher chances of cloanal atresia. The treatment includes euthanasia if they are severe. If there's a neonate and straining with abdominal distension, you will diagnose atresia ani, so no anal opening, and here human euthanasia needs to be considered too. Then comes ataxia, which is asymmetric, so meningeal burn will be your top diagnosis, and you are going to do elimination or treatment and seeing what is going to help. And treatment includes fenbendazole. If there is anemia plus weight loss, your diagnosis is going to be mycoplasma, and we will do a PCR test in order to confirm it. Use long-acting tetracyclines to treat it. If we see hypoproteinemia plus lethargy, then coccidiosis is your top differential. And you will do an extended fecal float because the oocyte is heavy, and treatment will include ponazuril. If there's an aggressive male, then it's Bursick male syndrome, and they will have a history of being human red. So all you can do is behavioral modifications and castration. If there is colic plus teeth grinding, then C3 ulcers is your top differentials, and treatment includes omeprazole. Okay. Any questions?
Actually, I see that in case of atresia ani, you said that you are used the euthanasia. Is that right?
Mm-hmm. Yes.
But in India, we can't do anything like that. Why?
So
We
you
just
can
we
perform
just
humane euthanasias in India as well. It depends because it's a neonate, and if you do a surgery, there are chances of the surgical site dehiscence happening because of the location.
okay. So you say
Yeah.
that if we perform the surgery crisscross cut on that, then it mean that more chances of infection is
Yes,
then
yes, yes.
okay, okay.
It will take
That,
a long time for that site to heal because there will be poop involved, and
so
the success
ex-
with your surgery will take a longer period. Sometimes it is successful, sometimes it is not.
no, it's not like that. Uh,
Mhm,
in India, we used in the case of atresia any, first we should
mhm,
cut the first we should cut in their natural shape, and then
mhm,
from where we cut it, we should little heat instrument is there, and
mhm,
we should heat the skin from mucus layers, and that makes healing is more faster. So
Oh,
it
okay.
should be very useful. We use many times. And
That is.
rarely infection occurs. Rarely infection occurs because infections occur where the cells are
Mm-hmm.
live. If cells are not live, then infection is not occur.
Okay. I didn't know about this. Good to hear. Any other questions? Okay. So, Dr. Vijender, exam point of view, please write euthanasia. Do
Yeah,
not
yeah,
try.
yeah.
Yes.
No, 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 no. We are
Good.
looking for naval, not for
Yes.
India. So we
Yes.
should
Yes.
go with naval
Yes.
also, not our knowledge. The
Good. But it's
things,
good to hear that we have ways to do it. That's good.
because we should also use liquid nitrogen to
Mm.
damage the cells. They make good if you not have electrical instrument, then use it liquid nitrogen, and it's very less painful for animal. Sometimes not pain and very
Okay.
helpful.
Great. Okay. Any other
Because
questions?
we are living in India where farmers are very poor, so we do
Yes.
things like that. Uh,
No, I
because
understand.
because we need actually the main problem is that the farmers are really very poor because of their food, and their home economy is run by the animals, not by the other things. So
Yeah.
for that point of view, in India, veterinarians are literally poor. Thank you.
Okay. So I haven't added questions in this lecture for you guys to do after the lecture. I want you guys to go through the entire lecture, and maybe before my next lecture, we'll have a small Camelid question round where I'm going to put a few NAVLE like questions and a few BCSE like questions. So just a reminder, I don't know when my next lecture will be, but whenever it is, I want you guys to prep for Camelids, okay?
Okay. And please answer this question. I am very confused about it.
Mm-hmm.
After, actually, first is that the jobs are more in field of veterinarian in worldwide. That's it. Another thing. Actually, I'm very confusing about that. One thing is only one thing. Is that really very good environment to do a job in abroad like America and Canada? Because
Mm-hmm.
I'm not habitual about the life security things of like pension schemes and other things in different countries. In India, we think that we should gain the pension from government and we enjoy that our life. Is
Mm-hmm.
in developed countries we have some kind of program to, because after some time we are very weak now. After 50
Yeah.
years we should not handle the, and we are not able to handle the animals also because
Mm-hmm.
loss of powers, and then we then what should we have? It's very
Okay, so in US, we don't have government jobs. We have private practices here. So there's nothing like pension, but a few private hospitals do provide a pension care where they eliminate a certain amount from your monthly wage and keep it as a pension investment. And after you retire from that job or you decide to leave that job, you get that entire amount.
okay. Thank you for
So
answering.
answer was no, we do not have pension related things here in the US.
No. Thank you. So much. It's the mean that the government have equal pension scheme like that. It's also
Mhm.
okay. Thank you,
Also,
doctor.
ma'am, uh,
Mhm.
hi. So I was just saying, so we saw that the blood cell is different for camelids, right?
Yeah.
So like in labs and all, how does it differ for the normal RBCs and for camelid RBCs in the labs? Like, are there like any hereditary stuff for this, like sickle cell anemia or something like that?
No, there's not because they have a high membrane flexibility. So no, there's not. But related to your question in the labs, so I didn't get what exactly you meant by in the labs. Do you mean automatic machine?
PCR,
Sorry?
like clinical findings when we put it in for PCR or something, like bacterial identification.
Mm-hmm. So for a PCR test, are you talking for a PCR test?
Yes.
Yes. So no, there's no interaction of the RBCs in the PCR tests. So okay, let's answer this question. So can anybody tell me how PCR testing works?
Yeah, please repeat it.
Can anyone tell me how PCR testing works? How do we work? How do we detect things on PCR?
Which things?
Genetic
Um,
identification.
Mycoplasma,
Genetic
if you want to detect mycoplasma via the PCR test, how does the PCR run and what it detects?
packed cell volume. That's all.
Genetic material, DNA.
Yes.
Okay.
And how
PCR.
PCR, the
Okay.
polymerase chain
Okay.
reaction.
We should use it for the amplification of small amount of sample to the large amount to identify what is that.
Yeah, so in the PCR, we test for the DNA, right? So the DNA of the organism, right? Sorry. I think it was a lecture, right, for you guys in undergraduation, where you learn about denaturation,
Yeah.
annealing, and extension.
Yeah, we should have also that.
Yes. So, so yes, it will amplify the DNA and then detect it.
That's
So
all.
the shape of the RBCs is not going to affect the PCR testing, if that was your question. Any other questions?
So one thing is I'm very happy to hear that in America the camels
Mhm.
doctors are less. I think we should go with them. I'm from Rajasthan now. We have a lot
Mm-hmm.
of camel population. So it should be differentiate me with others.
Mm-hmm. Okay,